Hello and welcome. Today we're going to be talking about alcohol and other drugs. So, for the main points, we have to ask the question: is there a relationship between alcohol and drug use regarding social class, gender, age, and race? And then you can also look at other factors like sexual orientation. For example, who's more at risk for using and abusing drugs and alcohol? Is it associated with where you're located in the class system? Is it associated with being male, female, intersex, or any variety of genders? Is it associated with age? Is it more likely for youth? Is it more likely for adults? Is it more likely for the elderly? Is it more associated with race? Is it associated with being white, Native American, Asian? Another question: what major health and legal problems are associated with abuse of alcohol and other drugs? Again, if we're going to define drug use and we're going to label something as drug abuse or alcohol abuse, we have to have a social context and a cultural attitude, a cultural norm, even laws to define what exactly that means. And then we also, as a social problem, have to look at it and ask, how does it affect society? Again, how is it associated with people's health? Does it cause dysfunctions in society when you have a really high level of addicts, for example, or people that are on opioids? Another question: what drug and alcohol prevention strategies and treatment programs are widely acceptable? And again, what can we do as a society, as groups of people, to help reduce the problem of drug and alcohol use and abuse? So, if you look at the chart on the left, we have our national drug overdose deaths. And as you can see, for example, since the doctors started prescribing opioids and then the doctors became regulated and people started having to get their opioids via synthetics, you see an incredible rise in overdose deaths. Again, this number started to increase when the doctors were prescribing opioids, but then it really spiked up when people could no longer get their prescription drugs again. When it comes to drug and alcohol use, at what point do we define it as deviant? There are some cultures that feel that any drug and alcohol use is associated with violating social norms. And again, that depends on your culture, your religion, your country of origin, your common way of life. Again, drugs and alcohol are chemicals just like food that alter the body. However, when they define drugs and alcohol, they say it's any chemical substance other than food that alters the body. And again, we have to ask, why is it a social problem when people use drugs and alcohol? And again, there's a whole philosophical debate on this. And again, you can look at classic Native Americans using it for religion. You can look at it as, the cocaine epidemic in the 1980s. Is there a difference between what was happening in the 1980s regarding cocaine use than there is for using drugs for religious purposes? Alcohol is considered a norm in modern times, and it has been for centuries. But again, at what extent should alcohol no longer be considered a norm? Alcohol use is associated with date rape and violence. It's associated with family problems. It's associated with not being able to hold down jobs. So again, at what point are we going to label something as deviant? At what point are we going to label drug and alcohol use as recreational? And at what point does it become a social problem? Or is any drug and alcohol use a social problem? And again, this is culturally constructed, meaning that through interacting with other people, we as a society, as a group of people, as a culture, people with a common way of life, dictate what is acceptable and what is not acceptable. And again, do we need structures in place, laws in place to be able to restrict drug and alcohol use? Should we have that? Such as, is it good to have laws against drinking before you're 21 years of age? You can go to war and die at 18, but you can't drink until you're 21. So again, during Vietnam, they lowered the age to 18, realized that was incredibly problematic, and they pushed it back up to 21. But again, the people most likely to be involved in a fatal car accident are people 21 to 25. So we have to ask, do we need an age limit? Should it be pushed up to 25 just to reduce down the traffic deaths? Drugs and alcohol can be used for therapeutic purposes, such as with the medical field, recreational purposes, and then again, at what extent does it become abuse? At what point does it affect society so greatly that we need to label it as a social problem and impose some measures of social control to be able to limit access, and then some other treatment and other things to help people that are addicted? Again, should things like opium and cocaine be criminal and marijuana not be criminal? Again, these are all philosophical debates that need to be, the discourse should occur in a public place. with our government, within our communities, within our families, to really discuss what's acceptable and what's not. Again, in sociology, we're not here to judge. We're not here to be biased. We're just here to observe, report phenomena, analyze the situation, and again, that's what we're doing. And we can see that some drugs more than others cause more social problems. Should shun drugs like opium and cocaine be legal and marijuana not be legal? Be legal. But maybe driving on marijuana is incredibly dangerous, so should we have really high penalties against driving after smoking marijuana, for example? Just again, these are the debates, the philosophical debates attached to drug and alcohol use and abuse. So drug abuse is defined as the excessive or inappropriate use of a drug that results in some physical, mental, or social impairment. And the book states the objective components, again, physical, psychological, or social evidence that harm is being done to either individuals, institutions like the family, communities, or all people by the use of a drug. And if you look back at the opium trade with the British going in the 1800s and the effect it had on Chinese society being highly addicted to drugs, or in Pakistan right now where 5% of the population is addicted to opiums, does that cause social problems? And then the subjective idea, it's people's perceptions about the consequences of using a drug and the social action they believe they should be taking to solve the remedy. Even if people aren't getting in trouble, aren't getting arrested, or able to hold down the job, maybe their life itself is actually a struggle because they either can't stop or just the use of drugs and alcohol is causing problems in their own life, okay? So again, objective, the social perspective versus the subjective, the individual perspective of whether or not they're addicted. Drug addiction or drug dependency defined as a psychological or physical need for a drug. And then you have to use the drug to maintain a sense of well-being to avoid withdrawal symptoms. Drug dependency, again, has two characteristics, tolerance and withdrawal. Tolerance is defined as when larger doses of a drug are required to produce the same effect. Withdrawal refers to what happens when you no longer use the drug. How does that affect you? Alcohol use and abuse. So your book breaks it down into the different types of users. Okay, you have social drinkers that are just occasionally having a drink and it's recreational. Heavy drinkers who are doing it more than just when they're out being social or just the occasional glass of wine while they're watching Lord of the Rings. Acute alcoholics, these are people that are starting to become dependent on alcohol, where they start to plan their schedule around drinking. They even try to cut down, but when they do cut down, they tend to be thinking in need and want something. Chronic alcoholics, the people that engage in compulsive drinking. And the book breaks it down such as hiding liquor, sneaking drinks, etc. Basically, your drinking is out of control in a subjective and an objective opinion. Depressants, alcohol is labeled as a depressant. Again, it slows down the reuptake of neurotransmitters. That's what makes you feel the feeling. It lowers the activity of the central nervous system by blocking the reuptake of neurotransmitters. This is why your thinking is essentially slowed down when you're drinking. And this is why you pretty much get in car accidents when you're drinking too, because again, you see a turn coming up, but it takes that extra second or two for it to actually register when you're drinking than it would be when you're normally sober. Therefore, even though a curve's coming, it hasn't registered yet, and now it's too late, and you tend to go straight and maybe run into a telephone pole. The sad realities of drinking and driving. Alcohol and alcoholic beverages. These are terms that refer to wine, beer, and liquor. And again, the basis of whether it's wine, beer, and liquor is dependent upon the ingredients and also the alcohol percentage. Alcohol consumption, social class, gender, age, and race. Again, we're looking at all the social variables. Age, race, gender, sexual orientation. How are all these associated? Culture. How are they associated with drinking patterns and use and abuse? And drug and drinking patterns, use and abuse. Again, the book has a couple of key points. It talks about how your drink of choice and also drug of choice is associated with income. There is a relationship between social class and rates of alcohol abuse. However, it's not totally clear. Some studies demonstrate that people in the upper classes and middle classes are more likely to drink. Some studies show that the lower classes are more likely to drink. So again, you have some statistical differences between studies there. The book says that men tend to drink more than women, and men are more likely to be problem drinkers than women. Drinking patterns for teens are similar for males and females. However, drinking patterns for youth tends to be pretty high. White Americans are more likely than other racial groups to report use of alcohol. However, the book does break down that crosses cultures and it could be dependent upon the study. Alcohol-related social problems. Again, alcohol consumption in the U.S. has been declining over time. People are using less drugs, less alcohol, committing less crimes. Could be the advent of the internet, access to Netflix, whatever it is. A lot of these factors are going down. Even divorce rates are going down, which is great. However, we still see that alcohol is a social problem in modern times because alcoholics still exist. Chronic alcohol abuse is linked to many social problems, including health problems such as diabetes, dementia, cardiovascular disease, liver damage, fetal alcohol syndrome for pregnant mothers and their babies. Workplace, safety production, and absenteeism are concerns mentioned in your book. And then drinking and driving. Again, 1/3 of all fatal accidents involve alcohol, 32%, and most of them are aged 21 to 24. So this is a huge group that we need to be wondering about, maybe imposing more social control to reduce the fatalities in drinking and driving. And again, alcohol is associated with family problems, including domestic violence, socioeconomic factors, things along those lines. Tobacco as a social problem. The book has some statistics such as the highest rate of smoking is by Native Americans, followed by white Americans, African Americans, Hispanics, and Asian Americans. Again, we got to ask questions like, why do Asian Americans smoke less than white Americans? Is this because of cultural factors? The highest rates of smoking for both men and women are people between 18 and 24, followed by 45 to 64. The elderly are the most likely to smoke. Men are more likely than women to be current smokers. Again, cigarette smoking is less prevalent among adults who are graduates. So there's an association between race, between sex, between educational attainment level, between age. You're starting to see some of these factors. Smoking as a social problem is hazardous for pregnant women and all people. Tobacco is still responsible for 1 in every 45 deaths. Smoking typically shortens lifespan by up to 12 to 13 years. So again, is it a social problem or is it a question of free choice? Should we dictate and have more restrictions against tobacco and increase the taxes, etc., to be able to compensate for the health problems? And should we be concerned that smoking is taking years off of people's life as a society, or is that an individual decision? The book does mention other drugs such as prescription, over-the-counter drugs, and caffeine. A lot of these are just commonly used by people and we might not look at it, but again, at what point do we define abuse for people that are using too many prescription drugs or are drinking too much coffee? Or is drinking a lot of coffee good for your heart? Again, you have a lot of debates on this subject. Drugs and alcohol as illegal. Whether or not something is determined as legal, as violating a social norm, is highly dependent upon the time frame we're talking about. I mean, what years are we talking about? Because smoking in the 1500s, for example, everybody was doing it. And alcohol, people never used to drink water because the water was poison. So they drank alcohol because there wasn't bacteria. And again, go back to Rome and all the pregnant women were drinking wine. So again, we have to ask questions. Marijuana, George Washington grew marijuana and then eventually it became illegal. And now you see a big change toward it becoming legalized in certain states. Cultural attitudes are associated with whether something is illegal. Again, for people that identify as Muslim, for example, drinking is very wrong. The type of substance. What substance should be legal? Should ibuprofen be legal, but then cocaine not be legal? Because does ibuprofen have a major health effects? Is it a major social problem compared to something like cocaine? And again, our laws are a highly determinant of what is acceptable and what is not acceptable. The book talks about other drugs such as stimulants, cocaine, hallucinogens like marijuana, LSD, and mushrooms, depressants like alcohol and barbiturates, narcotics such as opiates. Which of these should be legal, which of these should not be legal? Again, it's culturally constructed, but as you can see in our society, the most extreme drugs like cocaine, crack cocaine, opioids, LSD, those that can be very detrimental, those ones tend to be illegal. And again, what makes something illegal is our cultural attitudes, and then our cultural attitudes then are associated with the laws that we pass with our government. When we look at addiction, we have to approach it from a biopsychosocial approach. Again, when it comes to biology, how much of your genetics are associated with alcohol and drug abuse? and addiction. And again, what the doctors find is that yes, genetics do play a part in much of our behavior, and we do have some deterministic aspects of our behavior. And so, alcoholism, drug abuse runs in families just like other health concerns like diabetes or cardiovascular disease or cancer. From a psychological perspective, we're looking at personality, lifestyle, anxiety, depression, social learning by observing others, your emotional states, the functioning of your brain, the decisions you are making, what's driving you, what's motivating you. Again, are you coping? Are you trying to deal with trauma and so you're using drugs and alcohol? From a sociological perspective, we're looking at factors like economics and culture, family, media, government, and other forms of social control. Again, how are economics associated with addiction? I mean, you can look at it this like people that have a job, are they less likely to be drug addicts than people that don't have a job? And again, growing up poor, is that associated with addiction? The culture you live in, what's acceptable and what's not? Are you around people that use drugs and think it's totally normal because then that's associated with you using drugs? Do you grow up in a family where drugs and alcohol is normalized? How does the media present drugs and alcohol? What kind of restrictions and social controls are imposed upon by the government? And again, from a functionalist perspective, we're going to look at what's the purpose of using drugs and alcohol. Again, for recreation, for religious purposes, for fun. But at what point does that become a dysfunction in society and cause social problems that the institutions that structure our society are starting to break down? From a conflict per theory perspective, again, who's the one controlling the drug trade? You know, who owns the land in Latin America that's producing all the cocaine? And then who's having to work on these fields and be the trafficking runners? You know, is it associated with the rich and the poor? The rich, the landowners, the cocaine producers are making money off the cocaine. Then they're selling it to the lower class people that are more likely to be using cocaine. And the people that are selling the cocaine tend to be lower class without the jobs, for example, with low educational attainment. And again, symbolic interactionism, we're the ones who built the society. We're the ones who create these drugs, who socialize the use of these drugs, who produce these drugs. At any time, we could stop producing it. We could stop making alcohol. We could further regulate it. We could create more laws. We could create less laws. We can change all of our attitudes. Again, that's symbolic interactionism. Solutions to the drug programs. Again, we do have prevention programs. And we also have treatment options. But again, are these successful? And we are going to find that prevention programs and treatment options do have an effect. However, it doesn't cure the problem. So again, we need some support from the laws to be able to keep drugs out of people's hands at times. You need to look at things like helping people get out of poverty, helping people get an education, because again, the best way to end poverty is through an education. The best way to increase overall life chances, including one's health, is associated with education and getting out of poverty. So again, these are some major factors we need to consider as solutions. Okay, thank you so much.